Well, hello everybody, and happy Tuesday or whatever day of the week it is that you're listening to today's episode. Hi. So today's episode is a little heavy and a little intense. It seems to be an unfortunate theme as of late, but one that is a wee bit necessary. So let me preface with today's episode is all about the proposed changes to ASHA standards. If you're not aware of this, it all happened very, very quickly. So in May, ASHA issued a brief, not highly publicized suggestion to change our 2020 standards. Basically to remove any references to DEIA. And right there is where I say there's no way that today's episode doesn't address the literal elephant in the room. And yes, it does get somewhat political. Because that's why there are proposed changes to our standards. There's proposed changes to our standards because certain states have passed policy and law to no longer fund organizations, nonprofits, entities, schools, research, blah, 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 that has the buzzwords diversity, equity, inclusion, and or accessibility in it. So putting that part aside, to go back to today's topic, ASHA issued a statement saying that they were considering changes to the policy. There was a 10-day window from May 20th to June 10th, I believe, is what the original window was. Based off of a significant amount of advocacy, that window was extended until June 29th. Which is roughly 12 days away from today. And then based off of additional advocacy, it looks like the window for public comment is open until July 10th. So, Pac Dawson has had all of the things going on in our world, including but not limited to buying a brand new HVAC system because it's been hotter than Hades in our house. And our 32-year-old machine finally went kaputs after flooding our basement last fall. We thought we could, hang in there until the spring and then the summer. And then no, it turns out mommy having perimenopausal hot flashes at night is what kind of kicked it over the edge. So we've had contractors and now we have an HVAC system. So whoop, whoop, they actually turned it on this morning. So I'm trying to record our intro before Valley Heating and Air and their amazing selves, y'all. I love Valley Heating and Air before they come back and finish the wiring. But because of all of that, I hadn't had a chance to be fully present professionally because my personal life needed attention. And I say that because that's a bare reality. A huge chunk of my colleagues and friends and family, we are doing the next best thing that we can do because summer is upon us and we're juggling changes in kids' schedule. We're handling all of these things, right? Which is why when this proposed change happened with the tiniest of windows, I didn't get a chance to process it. It wasn't until two very dear friend and mentors made a couple posts on their social media and Facebook, and one of them messaged me and was like, "Hey, Michelle, so Dr. Faye Murray from Northern Arizona University, and she's one of the coordinators for SIG 14. She's been heavily involved in lots of advocacy. She's past president of Arizona. We met at a CCC conference. Faye reached out and was like, have you seen this?" So I called Faye on a Saturday morning, literally, 3 days ago, and was like, what can we do to help? And so Faye crafted today's team. Faye reached out to her network because that is how small our world is that if you don't know a body, somebody that you know knows that body. And She pulled together today's brilliant, compassionate, caring colleagues. You see the CCC pun? And all of these individuals share their first world experiences, share their knowledge, their convictions, and get very authentic and share their fears of if this suggested language change happens, if we remove our hard-fought 2020 statements. And I'm going to pull this up just so that y'all can actually see it. The proposed policy changes are to standard 4/B, 4/G, and 5F. And it says, instead of offering culturally competent, diverse, diversity, equity, and inclusion guidelines, that we're going to transition to person-centered care. If these policy changes happen, the ramifications on the other side of this are profound. Thoughts that I hadn't even considered, and I have given this a lot of headspace. So that's what we're doing. I want you to take away that each and every single one of us is ASHA. I want you to take away that your voice has power, that your words have weight, mine included. I don't fault ASHA leadership for these proposed changes. There are probably fears and threats behind the scenes that we can't fathom. But what I am asking as one human is that we stand strong to our convictions and our morals in the face of adversity. What I am asking is that all humans deserve respect. What I am asking is for us not to change these policies, because I do not represent the patients, the students, the clients that I serve. I shouldn't have to. I know my life and my walk, and that is enough for one lifetime. We need these policies, as they're written in our certification standards, to charge us, to remind us, to learn about others, to be empathetic, to learn about the foods that child, that family, that they may eat, and then how to turn that scientifically into the safest, least restrictive PO diet so that we don't have to worry about aspirating, but that we can grow their oral intake in conjunction with their culture, their faith, so that we learn about the language that's important to them, so that we learn about vocabulary words that they may have lost, but that they want back after their stroke, whether that was perinatal or when they were 72. We need these standards to say the same so that faculty, new faculty, old faculty, everybody remembers to reassess their syllabi and their assignments at the start of every semester instead of rinse, wash, repeat the same things that have been out there for 10 years because y'all, but put specific emphasis on incorporating different backgrounds, different thought processes into our assignments, into our application of standardized testing, and why this one might be biased. We are ASHA. And I truly, truly believe that if we unite, if we stand our ground, if we implore leadership to not change in the face of adversity, but to instead unite with our OT, PT colleagues, if we create a united front and say, our standards have merit, and I mean the real kind, Can't we fight off the boogeyman? So today's a lot. I beg, 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 and plead with you, please, at the end of today's episode, if you feel so convicted, please log on to ASHA. We'll put the hyperlink in and fill out it's only like 3-question survey for the 2020 standards. You can give them your feedback. You can give them your thoughts on whether or not you think they should change. And if you do, I mean, that's your heart, right? If you think we should revert back to 2017 standards, then I acknowledge that you and I might have differing understanding, but I'm still going to love you because that's what my Jesus said to do. Because again, my Jesus loves everybody. But y'all, fight with us. So without further ado, I will pass you off to today's episode. The guests are amazing. We timed this so that 2 of the guests, Dr. Vishnu and Dr. Betty, could join from Australia. So this was, good Lord, Faye went all out. Even Waffles is in agreement. But yeah, so till we chat again next week, have a lovely week, and happy Juneteenth to everyone celebrating. This seems appropriately timed. Happy advocating, y'all. All right, everybody. I know that Chad, who is CEO and produces behind the scenes, always teases me about when I say, and we have none other than, but y'all, the lineup of guests that we have today are all none other than. They are all some of the most respected colleagues from across the globe that we have. And they are here literally with 48 hours request from one of our guests, the one and only Dr. Faye Murray, because of a pretty large, crucial change that ASHA looks like they might be making. And we only have now until July 10th to take advocacy on. If y'all tuned in earlier this month, then you were able to participate in our DEIA talk on pediatric feeding and swallowing disorders. You've heard from guests representing other entities on the podcast before, the Asian American Pacific Islander Caucus in Basel. You are all aware, if you listen to the podcast, where Erin and I stand. And if there is any question, let me give you my unofficial, very clear bias now. DEIA matters. It has mattered to us. It will continue to matter to us. We do not want our standards change, Erin and I, because the beauty of humanity is the complexity of the lives that are interwoven. And it is an honor that we get to serve these individuals from all walk of life. And I know my walk, and that's it. That's all I should know. But I have the opportunity to learn from others about those we serve. So today we're going to do a whole lot of listening to great minds, why they talk about the certification standards, why they talk about this potential rollback, and what we should consider and the impact that it has. So without further ado, I get to introduce my sweet friend Faye from Arizona. And I love her so much that I called her on a Saturday morning while I am pacing in mid-anxiety attack at the pet store trying to find Waffles, who you will hear, a travel to-go bag and a bunch of other goodies because I am a smitten puppy mom, and said, hey, I have this idea. What do you think? And she goes, well, I'm sitting in a forest, because of course Faye is sitting in a forest, and I think I might know the right people. And then bloody hell, she pulls off one hell of a crew. And so here we are. So Faye, hi, thank you.
Thank you. I want to thank you for this opportunity. And I'm going to start off by just stating something, and then I'm going to let the group here, as they come up to introduce themselves and talk about, we have people that are more that have done a lot of research, that have done a lot of work in this area, and we need to hear their voices for sure. And it's quite an eclectic group. But ASHA is trying to remove explicit diversity, equity, and inclusion standards from our certification and accreditation requirements. The standards we just fought so hard to get, and they're replacing it with some vague language about person and family-centered care. But let's be real, you can't serve people well if you're not trained to understand their culture, language, or their lived experiences. This change silences what matters the most: equity, justice, and access. And we really need to speak up about it. And so we're here to start the conversation rolling, because it appears that there are a lot of people that don't understand. The DEI has become a thing that it's never was intended to be, this buzzword, but we need to call it out. What is diversity? What is equity? What is inclusion? And why are audiologists and SLPs, why do we need to be involved in this arena? What does it mean to our practices? So anyone that wants to jump in, we have Amy and Archie and Betty and Reem and Vishnu. So let's get started. What do we want to say about these standards? Anybody want to give a background on the FCC or the CAA?
Well, well, wait. I feel like I should introduce everybody. Yeah,
I
but
know.
so
Where
wait.
this
Okay,
is gonna go.
Faye's with Northern Arizona, and you and I met at CSAP. You're past president of Arizona when I was past president of South Carolina, or maybe we were sitting presidents. I don't know. That was blood, sweat, and tears, and that's from a bygone era. But to your right on my camera, I have Dr. Amy Hobek. Am I saying your
Yes,
name correctly?
you are.
Yes. And Amy, where are you? And please fill
I'm
us in
from
there.
the University of Cincinnati. I have been faculty there for 11 years, and my scholarly and teaching interests are in the area of cultural and linguistic diversity. I teach multicultural courses. I do clinical supervision in very culturally and linguistically diverse preschool at the University of Cincinnati. And this has just always been my passion. And I'm also affiliated with MBASLA. I am the co-chair of the Cultural Humility Task Force. So that's just a snippet of who I am.
Awesome. And then to your right, I have Archie, who has been on before. Welcome back, Archie.
Hi, thank you for having me. My name is Archie Soelaeman. I'm a speech language pathologist working at a therapeutic day school called Helping Hand in the southwest suburbs of Chicago. And I am also the co president of the Asian Pacific Islander Speech Language Hearing Caucus.
Awesome. And if memory serves correct, you do a fair bit with early language and AAC and routines based. And no, it's been a little while, but yes.
Yes, yes, yep. The majority of the students on my caseload are individuals on the autism spectrum.
Yeah. Folks, you'll have to go back, but we do have a whole podcast just talking about AAPI from about 2 years ago. Um, yes. And then Dr. Betty and Dr. Vishnu, who are joining us from Australia while Dr. Betty is on sabbatical, is my understanding. So thank you for breaking sabbatical to join us. Also for waking up at the butt crack of dawn loves. So please introduce yourselves.
Yeah, hi. It's 5:17 a.m. in Australia. We're really happy to join you. We've been out here doing some work, and because this issue is moving very quickly and it's quite urgent, so it's fine to break sabbatical once in a while for things that are important like this. And I'm a professor at San Francisco State University. I also am a co-managing editor along with Dr. Khamis here at the Journal of Critical Study of Communication and Disability. I have a lot of interest in my research and my clinical work and my advocacy around equity issues in our field. Yeah, and I'll let Dr. Nair introduce himself.
Thanks, Betty. My name is Vishnu Nair, and hi, everybody from Perth, Western Australia. Um, I'm an assistant professor at University of Reading in the UK, where I also co-lead the Center for multilingualism, literacy and multilingualism's health theme. So you can already see that I'm interested in diversity issues, but particularly focusing on multilingualism. And for the past few years, my research has been in the area of critical and decolonial praxis. Moving and thinking about the profession, and thinking, making the profession move slowly towards disability justice. So justice is a core aspect of what I do and what I think. And yeah, this change, I think, will also have an international impact and will have an impact on that very aspect of justice. Thank you.
Hey, and thank you for inviting me. And I'm very happy to be in this panel and to be part of that dialogue that we're starting for the community. I'm a professor at LIU Brooklyn and the chair of the department, academic program director of the department. And my research focuses on language development, processing, and clinical practices in a specific case called diglossia, where you have a language that you speak that is different than the language that is used usually for reading and writing. You would say similar to African American English speakers who are expected to use standard white English to read and write, and how we as a system are facilitating that transition, and how we assess and provide intervention that actually can tap into that situation, and usually we don't. I'm also one of the co-founders of the Journal of Critical Study of Communication and Disability with Dr. Betty and Dr. Yvette Heiter. It's I think I've been through all my work working with diverse communities in back home where I come from, with Hebrew speakers and Arabic speakers. And then when I moved to the USA, I became more understanding of the effects of the society, even more with the work on the different cases of children who speak Arabic and are expected to maintain Arabic in a situation where Arabic is actually treated as inferior, or there's less exposure to it, or so that work became more a catalyst for me to understand more the importance of discussing equity, and then I took it further a step in my work as a professor, and I'm happy to share all my knowledge so far, and I know it's something that we grow with, and I'm very sad that ASHA decided to take us back, because there was a momentum, and it was a good momentum, and it would be very important for the relevance of this profession. And I would be happy to talk more about what does it mean for us to do that change, especially now when a lot of people in the public are sharing a lot of information, questioning what's the role of speech therapist. I'm sorry, it became more than just explaining who I am.
No, but it gives us insight into your why, into like your heart in it. Because I mean, once upon a time we were all students trying to figure out what we wanted to do, and then our lives, and for me, my faith put me where I'm at. That's just kind of the journey. And then we have my sweet friend Erin, my partner in crime on the podcast. Hi, Erin.
Hello, I'm happy to be here. Thank y'all so much for coming on and having this conversation.
Okay, so I'm going to toot her
Can I
horn.
add something, Michelle, really
Go
quick?
ahead.
Because
Yes.
you mentioned about your why, and I'm a professor. I'm an associate clinical professor at Northern Arizona University. But the reason I'm here is because of my why, as to why I ended up working on the Navajo reservation for over 20 years, and I speak Spanish. I'm a bilingual Spanish speaker, but I didn't speak Navajo. I didn't understand the culture. I didn't know. All the kids qualified, every single one of them, and I really was trying to do my best, but I didn't have the tools, and the tools required me to go back to school. And get an advanced degree. But I knew that I wasn't doing what was right for my population. I was even working in home health, and I was working at the hospital, PRN, and the population that I was working with was not. I did not understand. I did not understand well enough to pick the correct targets or the appropriate focus of therapy. And in my materials, everything was just, everything that I had was geared for a different population. I am here because I believe in explicitly calling it out and explicitly talking about what our standards should look like if you want to be an effective SLP, and if you want to work at the highest level in your profession, and you want to use evidence-based, and you want to be culturally responsive, you have to be trained, and you have to be able to use those tools. Anyway, I just wanted to kind of put that out there, that I'm not here as a researcher. I'm here just as a plain old clinician who did a lot of work, and I believe in it, and I still have a lot of work to do.
I think the beautiful thing is that you're brave enough to admit the errors of past clinical ways. Like, I am a reformed chewy tube feeding therapist. Like, can I get an amen for that? Right? Like, long gone are those days, but you learn from your mistakes. And yeah. Okay, so folks, if you're not familiar with what we're talking about, let me read this to you real quick. So ASHA is proposing changes to the 2020 certification standards, okay? And this is the framework that they're giving. Recent federal executive orders have resulted in legal scrutiny surrounding terminology related to cultural competency, diversity, equity, and inclusion. Even when terminology is lawfully applied and considered essential for clinical practices, some of the terminology within the 2020 certification standards could put ASHA certification programs at risk from government, state, and private actors. ASHA's Council for Clinical Certification in Audiology and Speech Language Pathology, CFCC, is taking steps that are necessary to ensure the longevity and integrity of ASHA's certification programs, and B, protect clients, patients, students' access to safe and effective healthcare. The value of ASHA's certification programs are not changing. They have directly on their website a surveymonkey.com/r/2020 _cert_changes. I will make sure that that link gets added to the show notes so that you can go directly there so that you can read it for yourself. And then they propose to close the feedback on June 29th. But when I talked to Faye over the weekend, she said that they were extending it, I believe, until July 10th because of the amount of pushback that has occurred as of recently. By recently, I mean like what, within the last week and a half. So that's kind of where we are. But I'm going to go out on a limb and say, and I don't know how to make this not political, but I don't think we should change our standards and who we are as a profession because of one tyrant and cronies and bullies. And that's my humble opinion, for what it's worth, based off of my inner compass. So on that, who wants to take it from there?
I want to add that, in parallel to the CFCC changes, CAA, which is the Council for Academic Programs in Communication Sciences and Disorders, began even before the CFCC with the idea that they would like to change the standards. And standards basically are when we have an accredited program in the field of speech therapy and audiology, in order to get accreditation, there are a set of standards. It's like criterion tests and assessments like we use, when we're assessing the people that we're working with. These are standards that are considered to be what is it that we as speech language therapy programs and audiology programs are expected to include in our curriculum so that we can make sure that everybody is ready for the CFCC. So they started with that change before as well and announced it, and they called it under equity, that they're doing it for equity. Equity in the meaning that some states are actually prohibited from doing DEI work. And in order to do equitable treatment for all programs, no matter what state you are, they're trying to now take it out. And I think this is very, very, I can't, I think it's very unprofessional based on the understanding of the meaning equity, equality. So anytime we teach what is equity, what's equality, we always think about that image, and we always show that image of kids that are trying to watch a game, and there's a fence. Yeah? And then you have one part where you can give all the children, no matter what their height, the same steps so that they can get to see. Some will get to see a little bit more, but not good enough, and some will get a little bit less, and it's not going to give full visual. And then you have the other part where you can give the shorter kid, like, more steps, and then they will be able to get more. And then you have social justice where you take off the fence. But when ASHA and CAA are saying, we're going to take out this TEI, if you're thinking in terms of that image, what they're doing a big wall. So instead of taking off the fence, they're putting a big wall for all the programs so that none of the students that are in speech therapy programs and audiology programs are going to get access to education related to DEI. So I think it's really important also to note even the language that is used and how this language is inconsistent with the basic meaning of equity. And that's very scary from a professional association like the CAA.
And I mean, let me just put in a little bit of my 2 cents here because first, we were given the information that the CAA was going to propose these changes on May 20th. And they gave until June 10th was their first deadline for the public comments. That's 20 days at the end of the school year. Different programs are going to be very busy with graduation. No one is really going to be focusing on these things. And then I know, the Asian Pacific Islander Speech Language Hearing Caucus, we have an anti-racism learning community. And so we decided to call a meeting, and about 40 individuals joined us on that meeting where we discussed some of these changes that they're proposing and how it would definitely harm our profession. And so we, informed, got emails out, and there were some program directors who didn't even know that this was happening. And I think because of our initial push to submit comments and kind of get this word out, then they were able to push back the comment deadline to July 10th now for the public part. But the main thing too is that for the CAA standard for accreditation, it first started, the standard in 2017 was pretty short. And then in 2023, because of the Black Lives Matter movement, the murder of George Floyd, they were able to expand it exponentially what these standards are. And now, if you look at the different standards side by side, they are proposed. It's essentially moving it all the way back to what 2017, if not even less and even more vague, which is not what we need during, at this time. The world is only becoming more diverse. So we need to look at how can we make sure that our students are going to be prepared for working with this more diverse population. Because we need to make sure that our students are equipped with the tools when they're out there in the real world treating real patients, real students, real clients who don't look like them.
Yes. Erin and I represent and the bulk of our profession. I mean, it is the bulk of our profession is, well, Erin, I'm still older than you, but middle-aged white ladies, right? Like Erin doesn't count in that category yet, but yeah, but there it is. We don't have the lived experiences and we're not explicitly taught. And I can tell you, when I graduated, we did not have there was no embedding of cultural considerations in my academic training. And honestly, I know as an instructor, because I teach adjunct for North Carolina Central, which is an HBCU in North Carolina. I look back at this one class that I've taught at 4 different iterations, and each time I finesse it further. But there has to be explicit thought in how do I make sure that I am creating an opportunity for the students to learn about different cultures within the framework of pediatric feeding and swallowing disorders. But that is a conscientious decision to do that.
I would like to add another point, that this standard is not only about serving people from different races, it's also about getting better understanding of how to serve the people that we are supposedly going to be standing up for them to have access to communication as a human rights, the people with communication disabilities. If you look at the specific items in that standard for CAA, it includes also information about deaf culture, information about AAC. So even though this has been politicized as something that relates to what is happening outside, our profession, we need to be very clear that this is not about the political discussions that are happening outside of the profession. It is about the core of our profession. And I can tell you, the public is already questioning what does it mean to be a speech therapist giving therapy for someone who stutters, for someone who's deaf and hard of hearing. Just in the last year, for example, and we're talking about public arenas. In the shed, there was I go a lot to art stuff. There was a play that has been by deaf artists, and they were telling their lived experience. And you go into the room and it's all in sign language. You're going to be the one that has to actually listen for a change for the translation instead of them listening to the translation. And it was so moving. But what was so moving as for me as speech therapist is that in all of these, and I can tell you more and more, we are the bad guys for the people that we're supposed to be standing up for. The same thing, there's this amazing play, a musical play, Danielle Sapon. I hope that it's going to get into Broadway. It's called Watermelon, and it's about this student who stutters, and her moment of freedom becomes when she decides she's not going to continue with speech therapy. So there's a lot that is happening now. Even in the Whitney Museum now, we have an exhibit by an artist that shows us as part of the barriers, like we're there, speech therapist, this is the name. So at this point, if we're not going to work on addressing ableism as much as we address racism, as much as we address sexism, we're going to be irrelevant. Nobody's going to even choose to work with us. And then that's it. It's the end of this profession if we're not going to be hearing to the people that we're supposed to be advocating for. And that's just the public. That's not even the lived experiences that we're always, Faye was saying, I felt something was wrong. We all have these feelings, and we all can share many feelings where we felt like something is wrong. I am not in this profession to make them feel this way. But here I am. I'm doing it with the standardized assessment, with the setting of goals to be all focused on oral language and specific type of oral language, for the specific expectation of parents to be preparing their kids for homework and use specific type of language without seeing their full picture, where they're coming from, what they're challenged with. How do they even understand the connection with me? Do they think of me as a doctor and medically I'm the one that makes decisions? There's so much. So if we really care about our profession, we should care to maintain this. That's the way I look at it.
And I think that one of the things that I just keep thinking about with how Archie was talking about how it changed over the years is just that now I feel this I've been calling it DEI whiplash, where it's just you're just pushing us from one way to the other way. And I started teaching a multicultural course in my PhD program at the University of Cincinnati. I just requested to see if I could do it because nobody was doing anything DE&I multicultural at that time. And I was actually taking courses in the literacy department that was demonstrating to me what I actually needed to know more of when it comes to understanding individuals from different backgrounds, and really understanding that a lot of the things that I was being taught in our field of speech language pathology was from a deficit perspective. And so I really worked really hard to learn as much as I could and teach this course. And nobody in our program really seemed to value it. And then, these standards changed, and George Floyd and the Black Lives Matters movement. And then all of a sudden, I was revered as this person who could bring our program into, the CAA standards really quickly because we were already doing a lot of those things. And now I'm back to this place where I have had scrutiny from leadership in my program about teaching things that are being called political now. And I feel again, I'm being devalued, or the work that I do is being pushed aside and being told that this is not what we want from you. This is not valuable. We have a state bill that just passed in Ohio that, restricts all DE&I, things that we can and can't teach. But the accreditation standards are truly, in teaching the content that I teach, the only thing that's actually keeping me safe from teaching the necessary content. And what I teach is a framework of cultural humility. It's about self-reflection. It's about, understanding our own personal biases and so that we can understand the cultures of others. And I do talk a lot about power and policy and some of those things. And I'm being told that that's not appropriate anymore and that I shouldn't be teaching those kinds of things. But if it wasn't for the accreditation standards, I would be more discredited, and I would be less likely to be able to teach this type of content because our accreditation, our bill actually has an exemption for accreditation.
Okay, so Betty and Vishnu have something to add, but I do want to come back to the difference between accreditation and some of the policies, because unless a human has been in academia and understands those levels, they might not get the overlap. Betty, Vishnu?
So I wanted to applaud Amy for pointing out that the changes here are playing kind of to the lowest common denominator, that we're prioritizing compliance in the states that are being asked to illegally actually ban DEI efforts or whatever you want to call it. And we're not offering any protection or leadership for those of us who want to continue to do the work. And ASHA is saying, well, you could always do it. You just go ahead and do it, right? That the alignment is already telling a lot about what the priorities are. And I also wanted to give the larger context. I think, we're kind of getting lost in the forest, and we're being very short-sighted about what we're doing here. That the Council for Clinical Certification, for example, in their wording in the message out to the membership, said that recent federal executive orders have resulted in legal scrutiny around terminology related to cultural competency, diversity, equity, inclusion, even when terminology is lawfully applied and considered essential for clinical practice. So, one, they're revealing that actually the practices are not illegal, right? And so they're doing this maneuvering that seems to make sense if we look at only the short term, which is to say, all right, if these words are not okay, let's change the words. So there's a lot of focus right now on terminology. And by the way, the Minority Student Leadership Program now stands for nothing but itself. It is just going by the acronym MSLP. So we're also avoiding using words like minority. I mean, there's no end to this, right? But what is the efficacy of this? Let's just take a very pragmatic view. Okay, when the administration in January put out the executive orders saying that they were terminating all, they call it discriminatory programs and illegal DEI. Okay. So, one, we could challenge whether or not there is any discriminatory activity going on. And also, let's not forget that they are not they're not after what you call things. They say that they are going after these activities under whatever name they appear. I'm reading from a direct quote from the executive order. And here's another quote: the federal agencies must also ask employees if they know of any efforts to disguise these programs by using coded or imprecise language. So I ask you, we read the ASHA messaging saying that, our values have not changed, and we're changing this language, right, to avoid punishment in the different localities, and also very specifically, ASHA itself, it falls under the category of associations that they're after. But the thing is, we're already playing a losing game because they can still come after us. It doesn't matter if we call it person-centered care, family-centered care. So why, right? Why are we falling into the trap that clearly has been set up? So just on an efficacy standpoint, this makes no sense.
Completely agree. Yeah, I was going to say that we have a legal accountability, and that goes beyond. And we still have IDEA, we still have Title 6, we still have Section 504. Those have not been changed, and they required culturally responsive, non-discriminatory services. And removing these standards may expose providers and institutions to legal risk. At that level, and actually, our ASHA, our own code of ethics hasn't changed. I mean, it calls for culturally responsive and non-discriminatory practices. And how can we meet those, the code of ethics? How can we meet what the expectations for these other laws if we don't have training, if we don't have knowledge of how to work with diverse populations and people with disabilities, who are our main bread and butter, right? I mean, we are there to help people with communication disorders, regardless of their gender, their race, their ethnicity, their ability. And so, I'm so glad you brought that up, because I hadn't considered that. Because I keep hearing, Betty, about, what if we use this word instead of this word? And what you're saying is, it doesn't matter.
It doesn't
It
matter
doesn't
at
matter.
all.
I just want to add to what Query was saying, that in terms of the values, I would argue that the organizations were not serious to begin with about the values, because when you think about standards like this, obviously in a moment of crisis, when the values are put to test, is when you really know how much they actually value these values, right? And I've been really thinking about the debate that went around, for example, all the pseudo-scientific claims around autism. Few months ago, we had from the administration, and I was looking forward for organizations like ASHA to really come up with a collective statement, pushing back, because if you truly centered disability justice and really cared for the populations that we serve, that is the moment when we need to push back. You know, so, but instead, what we are getting is a complete compliance, a very easy compliance, one that they can give up really easily. And like Reem said, in effect, it's really not about. It is about, obviously, about the people. Students graduating with less competency and all of that, but it is also about the people we serve, because we talk about culturally or clinically safe practices. So, as our practice safe enough, or what will happen to our practice? We will be putting our practice to a lot of unsafe, and that will lead to a lot of probably lawsuits in so many ways, right? Like we just don't even know how this policy is going to manifest long term. So what is a long term impact analysis of this? Because any organization, when they actually change these standards in such significant way, they're liable to let the members know a long-term impact analysis of this. So I haven't seen that impact analysis, unless I'm missing something.
Mhm.
So that's one thing.
Yeah.
The other thing also I want,
I don't think it
yeah,
exists.
sorry, go ahead.
No, I say I don't think it exists. I don't think there's an impact analysis about this. I think everybody's just reacting, you know, reacting and trying to predict what they think will happen in the future, and trying to avoid, something that may or may not
Yes,
happen.
and I think it not only affects our students, it affects our it affects the population we serve. But it doesn't matter if they are racially or linguistically minoritized. Like Betty said, in any way, if somebody wants to get you, they can find something there, and they can actually try to get you regardless, right? I mean, you can find, could be neurodiversity. It would impact a whole lot of any which way, because we are a profession that directly serves disability, and disability itself is a problematic terminology in the current profession. So our profession is anyway a target. Anyway, no matter. So rather than doubling down and resisting on the current policy, and early compliance and giving up of this compliance really talks about the values and what we should be thinking. I mean, how we should even have this conversation, because in some sense, what we are also doing is a reactionary kind of, okay, we need more information, which is absolutely needed. But how can we push our organizations to really, really think and center justice at its heart? Because if you truly thought about justice, that diversity, then the reaction would be to resist rather than to comply.
I, go ahead, Reem. You
I
had a.
just want to add 2 points, to all of the idea and the other um, developments in the field that actually make it clear that we should maintain this. I want to also add about interprofessional practice. So there are a set of competencies for interprofessional practice that are divided into 4 levels of competencies, and they are changing every 5 years. And the biggest change that happened from 2016 to 2023 was actually the focus on population and the focus on social justice and cultural humility. So the interprofessional practice competencies 2023 actually include very explicit language about the need for us as interprofessional practitioners to work not only on person level, which is where they're taking us back to the person level like care, but population level care. They explicitly mention the importance of having cultural humility as part of our competencies. They explicitly talk about social justice work, which is the removal of the fence, like that we're talking about, that our people that we're serving, they should have a society, and we should work towards building a society that is open for them to be able to express themselves the way they are and be okay, and not be always feeling that they are not fit in and they have to work on themselves. But the other point that I would like also to add is, in terms of the long-term effect, that we also have to consider that we're celebrating 100 years of the establishment of ASHA. And now we have more and more data that is coming out about these years when it was formed. I highly recommend everybody to go and check Dr. Dukan website, where she has all the developments that happened. But there are 2 papers that talk about what were the choices that our founding members made at that point. The choices were to have a master's degree instead of BA for you to be a speech therapist, which was a very elitist choice at that point. The choice was to be against immigration, against being open for diversity in languaging, which also was documented in the statements that they were made. There were a lot of statements that were made by the founding members that are ableist statements, that they made it more on the person who is disabled to actually work on themselves to be able to fit into the society. Now, 100 years we're celebrating. This is a good time to look back and reflect back on what are these choices and how they formed us in a way that we are in this point. And what a bad choice that, on that 100-year celebration, to actually do that step. It's not a bad choice. For me, I'm thinking maybe this is the core of speech therapy. Maybe, as much as we want to believe that this is not who we are, that this is who we are. We are the mechanism that is enabling, all of the uh, scientific base to tell people who are disabled that you're not good enough, which I don't want to be part of this. If this is, I didn't sign up for it. And I know all of our students didn't sign up for it. I read the students' statements. This is not why they wanted to be speech therapists. And I think this is a very important thing to remember. And then what's the long-term effect of this? So in 4 years, if things change, how you're going to go back? How do you think the people that worked so hard on actually bringing all of that knowledge, that, you just erase it in a second and you say, oh, we're not going to work on it. When you tokenize them, when you brought people from the public, like Nair from, Dancing with the Stars, who's deaf, to talk about his experience, and to beg speech therapists that at least please make sure to tell the parents that sign language is an option. How is he going to look at us? And will he come again to us, to ASHA convention, and present his lived experience? So that like narrow thinking about not seeing the effect of it on the people who are working on this work, on the people who are being advocating and bringing their lived experiences so that we can change. And then you just, in a brush of like, a second, you just remove it and you think it's going to be okay. What does it mean about ASHA? What does it mean about the leadership? I think it brings us back to 100 years back and making the same choices, unfortunately.
Yeah, I just kind of want to go back and just kind of, with what Reem said earlier about the standards and removing the fence. Right now, like we're essentially putting up a wall, right? That's the analogy that Reem said. And we're really lowering the standards to everyone, for everyone, when what we should do is raise those standards so that we have clinicians who are going to be prepared, right, for once they're clinicians, when they're done with school, the students when they're done with school. And then I'm looking right now at the CFCC standard changes. And really, the words that they're taking out are all the cultural competency, cultural humility, culturally responsive practice, or DI recruitment. And they're changing that to person-centered care and or professional interactions. Every single one of them is changed to person-centered care. What does that mean? What does person-centered care mean? There's no like definition as to what that is. What it like if that person has an accent, are we going to be treating that? Right? Are we going to now go back and do like accent modification? What does person-centered care mean? Like with the different programs, like what Amy said earlier, we need to be specific with what we want to teach the students, so that they can have all of the tools that they need, or they can be better prepared, right? The first few years, they say you fake it till you make it, right? But if you at least have the tools, you can look into your toolbox to find what you might be able to use. But if you don't even have the tool, how are you going to know what to look for?
I was going to mention that they did actually explicitly define person and family centered care, because now those terms are carrying a lot of weight for us. Everything that we've been worked for now is packed into those terms. So it's very important for them to define it, but it makes no sense because now we're explicitly saying that we are disguising what we're doing under, which is also illegal. So it really goes back to, it doesn't matter if they've defined what that is, the fact that we're conceding that we're going to change our language practices. And let's not forget that we're language people. I mean, we're language people. We know that changing terms changes our alignment and resonance and what we're about. So anyway, I just wanted to say that it doesn't matter. They could say, "Oh yeah, we did define," as if it's going to invalidate your point, or Archie, and it completely doesn't.
I think the person-centered care was driven by WHO, like the World Health Organization from like years and years ago, but it's vague. It's not concrete.
I mean, with the whole 100 years thing, they're talking about the past, the present, the possibilities. We should be looking at the possibilities, right? What's the future of our profession? The students right now, that they're going to be the future of our professions, right? In 4 years, maybe they're still going to be SLPs, maybe they're still going to be audiologists, researchers. If and people, if they're talking about don't make things political, the person that's in office right now, in 4 years, they're probably not going to be there, right? But we are probably still going to be practicing.
Yeah, I was going to, when Betty was talking about language, that was going to be my next point too. We all know as speech language pathologists that language matters, and to deduce language into non-specific terms that are not explicit and intentional on what it is that we need to do for a profession to be able to serve all populations in all the ways that we need to, then person-centered care is not the language that we need. That does not help us move that needle forward. as Archie was saying too, like, so I am the this year's co-chair for the topic of equity, inclusion, cultural linguistic diversity for ASHA's convention. And so I've been really thinking a lot about this idea of envisioning possibilities for the future. And, when we were reviewing all of the amazing, actually, submissions that were put forward. And another thing that that also is a tag word that they're using for this 100 words is transformation. And this is not transformation. This is regression. And I think that, ASHA needs to think much harder on this, and need to listen to others, and instead of just putting a statement out, giving a timeline, and then saying they're going to go through a process.
I have several thoughts and I want to give everybody their opportunity, but I have to bring it back to this isn't just language, this is also dysphagia research and pediatric feeding and swallowing research. Because within our world of PFD, our norms are predicated almost exclusively on upper middle class white families from the Northeast, i.e., faculty children, right? And I know Dr. Amy Delaney at a Marquette University just received a grant from the ASH Foundation to broaden the norms in general, right? To create more robust resources for mastication cycles, for advancing solids and advancing textures, but doing a database to include individuals from different cultural ethnic backgrounds who may have rice as the primary ingredient as opposed to mashed potatoes on the kitchen table. But when our research is just tiptoeing into that, to go back to what Vishnu said earlier, long-term ramifications of this is that research that is directly tied to my patient safety on the tiny end of the world, because I see the tiny humans, because the big humans, their boogers are too big, but that research could dry up before it's even had an opportunity to be nourished, right? So, Erin?
I think two quick comments, but one, thinking about, like, I think a lot of the comments, and you hear people say all the time, like, I don't want to make this political, or like, this isn't political. Our field is inherently political. Policy affects everything that we do. And these conversations are important. And saying that stops a lot of these conversations from happening. But I need to know what the policy is. I need to know what laws are for school, for EI, for any child that I serve. And that's going to impact how I treat a child. That language is so important. And I think in any the big conversation too, especially with everything that's going on, is community. I'm trauma informed is something I'm heavily trained in. Safety is number one, and a big factor in helping people feel safe is community. And so, yes, we need to have this conversation as a field, as our discipline, but what about, like you were saying, interprofessional practice? What about other disciplines, other communities coming together? Because there's power in that. There's value in that, of us having those conversations, of us all being on the same page and standing in that. And not only is that valuable just in the reach that it has, but also in the safety of the people in all those communities. If I know that another organization, if I know that my OT colleagues are standing on the same thing as I am, I can go to them, I can feel safe. I worry also not just for the people that we serve, but for the students that we have, in them feeling safe. There's been such a push for students that are neurodiverse, that have, different cultures, different diversity, and how are they supposed to feel safe even being a speech pathologist with what this happened, and how much trauma is this causing for the students that are reading this and now saying, I am not valued in this profession because I am different. And that's not trauma informed, and that's not making anyone feel safe, and that is detrimental to our field in general.
Oh, I just want to give you a very funny fact. I went to ASHA website and I'm like, okay, let me search the word person-centered care. And when you look for that word, you will discover that there are 6,384 papers, but until 2021. So after 2021, there were no publications that used that term that now is supposed to be central to our standards for certification and central to our standards for CAA. If when I submit my program report, we need to show that our work is covered by the evidence. If the ASHA papers don't even have latest publications on a person-centered work, how am I gonna supposed to be bringing that evidence that is supposed to guide me in operationalizing that term? Meanwhile, the culturally responsive practice is still going, it's still published, more papers and beyond 2024 and before 2021. So just that's the, I think the part that is very puzzling is that making that decision is not aligned with almost anything that is that ASHA is doing in research, that is ASHA doing in advocacy work, that is ASHA doing in communication with students, that is ASHA doing in communication with the public. It's just like somebody that, I come from, like it's somebody like marrying someone and then all of a sudden you're changing everything about you. You're not yourself. Like, so what are we doing here? Like, is this what we're doing? We're changing the core of everything that has been done in research and in our understanding of our practice and our identity. Just like that, it means we're not ourselves anymore.
I have a crazy ex-husband. I felt that statement in my soul, and I don't want to divorce Asha. I want us to do better and to stand firm. Also, divorces are really expensive. I
Mm-hmm.
know. I
Been
mean,
there
that
too.
was been there, done that 15 years later.
You know,
Um,
I was
And
going to
we
say
are,
really quickly,
yeah,
this
we should
change
be
is driven
informing.
by fear of vague legal threats, not by education, not by the evidence, not by what patients need. It's a preemptive overcorrection of something that has really been not proven that it's a problem. Okay. And when the cycle goes away, there's a new administration coming in, and it's going to be really difficult to re-engage and to make up all these things that we're now doing away with. That's all I'm going to say.
no fear. You can feel it. It's palpable. Betty, Vishnu.
I just sorry.
Go ahead.
I
But
just
I have
want,
something to say too
yes,
after you.
I just want to say what Faye said just now in terms of we constantly changing things based on administration or political situation, and we always say that we are not a political of we're not politically aligned. The profession is politically neutral, but disability is political. I mean, this is very clear from everything that has been going on. So I think it again speaks to ASHA values, because when political consciousness is not being integrated within a profession, the profession doesn't know, or organization doesn't know how to react when there is a crisis, and that's what this is showing us, this sheer incompetency in terms of a compliance, early compliance. And I was just showing it to Betty. I was looking at the list of words that are banned by this administration, and the New York Times report that published on the 7th March 2025 has person centered care banned, actually. So it's not that person-centered care is again a politically neutral, a safe term, but that is on the list of terms that is banned, right? So so I think that was some explanation, but also the other element of the practice that we are talking about is that how is this word going to make us more clinically safe? And I was just sharing with Betty that. A lot of the times now co-production is such an important area, right? Co-producing goals with clients, for example. Right now, if you're a neurodivergent client and if you're creating a person-centered care, oftentimes that person-centered care would involve what the client also wants to achieve, that is co-production. Now, if that violates the DEI, is the client going to be unsafe? So I think that is actually opening up a host of questions. The other thing Amy was talking about, being an educator and not being valued, and I think that has not something been discussed in the actual classrooms. In the being an educator, how this will have chilling effect on educators and universities, you know. And if you just teach any kind of diversity issues, even if you teach multilingualism, for example, you know, that can put educators under risk. How are we going to deal with those standards or those kind of threats? So I think, um, I certainly think changing this is going to create an existential threat for our profession, and we are thinking about 100 years, and history won't be kind to the organization in the way the history is written and in the way ASHA is responding to openly, what is fascism. It's complying rather than resisting. It's very clear. It's very clear.
So, sorry to take our extra long term turn on this mic because there are two of us. But I am so glad that Vishnu brought up the historical context because I think we need to hop out a little bit out of our the profession and the disciplinary view and into a historical view. So I think we should be very clear that ASHA and associations like ASHA are in fact under threat. So I don't want to minimize that. And in fact, the January 21st executive order specifically says that they're looking for compliance investigations of publicly traded corporations, large nonprofit corporations or associations, foundations with assets of $5 million or above. That's us. And 500, oh yeah, 500 million dollars or above. And yes, we are that big. We are. But so we're in a historical moment. And there is we can look back in history for these historical moments. If we look back to the 1930s, um, you know what this is about, and that compliance will offer you only the most superficial safety. That we are in a moment where you're going to get punished no matter what. And so, there will come a time when we'll look back and we will always, there's a book by this title, one day everyone will always have been against this. But where it matters is when there's stakes, and the stakes are now. The stakes come when you're going to suffer. And so, yes, we may suffer for this. And this is the only time that it matters to speak out and stand our ground, because when we're not suffering, it means that the moment is over. We're living in a different reality. We're helping to create that reality by not saying anything. And yeah, in the 1930s, things worked out for on the side of freedom, and we're at a crossroads again. I have no idea how things are going to work out, but we're certainly not standing on the correct side.
Yeah. Well, first of all, Betty, I'm reading that book right now. It is a really good book, so encourage anyone to read that. But talking about these kinds of things and how in history will show that everybody was always against this, when in fact many people were silent. And so I think that, but what I was going to say has probably been said 100 times over already about values, but that's what I keep coming back to in my own head is, we have to hold firm to our values, because if we don't have anything else. And our values are really important. This is kind of related, but kind of not related. But years ago, the school district my children are in, there were individuals trying to take over our school board because they were teaching global competence and cultural competency in the curriculum. And the superintendent, I will never forget it because I worked on this fight to keep our school board safe, that he said, I just cannot let us give up on our values. I will not relent. So he could have taken the easy way out and changed the curriculum to satisfy the people who were, you know, fighting against him, but instead he rallied the community. We got the community engaged and involved and ended up being successful in this fight. And, it meant a lot to so many in our community that he was holding strong to what their core values were. And I think that ASHA really needs to think about this hard and consider this, because if we don't hold true to these values, we're turning our backs on our marginalized and minoritized clients, patients, families, communities, faculty, students, etc. And that is what we've been trying to build for so long, is to create a more diverse ASHA community, and to create better care for our clients. And we just cannot go back. It doesn't make any sense.
I was just like, I love this conversation, and I know that all of us being here today are on a very similar page of our perspective and our goals and what we want to happen. But I'm curious what everyone's thoughts are on, like, what do yes, we can, want to write to ASHA and make sure that our voice is heard, but what do you have any recommendations for the language people use in that? And also, do you have any recommendations for having those conversations, or what do people do if they're reading? I know I had a friend who's a speech pathologist, and she read the email and just felt so numb, and like didn't feel like it mattered what she said, or didn't know what to do. And I know that's the conversation that everyone's having on a bigger scale as well. But and going off of too, like that community piece, like that is huge. And like, even if it's one person that you can have the conversation with, that you connect with, that can then be another person, and making sure we're having those conversations, because I think that's also what happens is people don't want to have the conversation, and that's when we get ourselves in trouble. But I'd love perspectives on that as well. Like, okay, we are talking about this, but like, what do we do?
Betty, Vishnu, y'all had your hands up first.
I just don't have a long point. I only have a minor point on that. I think, Erin, that is such an important point. If you think about BLM, and what that moment did to our consciousness and the changes, we have to recognize that this is another moment. A moment that is much more harder, a moment that will have much more resistance. We need to show our courage, but it is in collectives that we can think. It is in community we can think about, think about changes. So I do think perhaps it is a time for us to organize again. It is that time. And I also think what ASHA is going to do is also something that I would like to see, because all of the institutions and the programs under ASHA is also under threat. So a mere change of DEI to person-centered care is not going to really change anything. What will happen to the multicultural office, for example, which is at the very heart of all the DEI issues? So there is a liberal institution functioning within the giant organization of ASHA that serve multicultural population, that is particularly focused on it. And if you really look at the history of that organization, there's a wonderful Asha Leader article itself around Orlando Taylor. Orlando Taylor had to fight really hard to even think about having black languaging and serving black children, and think making Asha think in that direction. And that received so much opposition from the therapist, from the white therapist at that point. But that activism to some extent led to the creation of multicultural office, right? So I am reminded of Orlando Taylor when we are actually thinking about these strategies and writing letters, because there was one Orlando Taylor at that time. I'm so glad we are in a community of different people. But this is history repeating itself in a different time. But it is just Asha's history repeating itself. So no matter what, we need to do what we need to do, which is to expand the highest possibilities of our own skills and potentials and speak to our higher truth, organize. If it is about writing letters, even if we don't sometimes believe in that, even if we don't think that sometimes that is not going to change any systemic, change, we need to do what we need to do. This is because this is what this moment is called for.
In terms of collectivist action too, it's not just the individuals, not the us members banding together. The APA in April also dropped their DEI requirements for training programs and accreditation. So I can see the pressure that ASHA is under as, another piece, another domino piece, right? Falling. But what if all of the associations were to band together? I mean, we're really, I think whether we're looking individually or in terms of individual organizations, everyone's prioritizing kind of keeping their heads down and, letting the storm pass. But it's not, that it actually puts all of us in more harm.
Yeah. Archie?
Just really quickly, going back to what Erin said earlier about what can people say, what can people do. There is a flyer that I can also share with you. But if people are wondering, like, what do, if they want to see a side by side table of the difference of what the CAA standards are in 2017, 2023, and what it is now. We have a flyer for that so you can see the different changes. I'm a visual person. You can visually see it. And then if you scroll all the way down, there are different comments. Sometimes things can seem a little overwhelming and you don't know what to say. And sometimes you just need a little, maybe, if there are some of those comments that could speak to what your heart is feeling, then you can expand on, just to, if you want some examples, it's tinyurl.com/caa comma examples. You should be able to see some example comments, and those are the comments that came up during our API caucus anti-racism learning community meeting, on, I believe that was June 6th or something like that. So there are some example comments that people can look at.
Thank you. I will make
I
sure to
think a
add
really
those
quick
to
thing
the
you can say is just please retain the 2023 language. I mean, it could be as simple as that, retain, don't change anything. Let's talk about it. And, if there's a fear, then we deal with that later. But I think we just need to stand and say, let's pull back. Let's stick to what we've got right now. Let's not make any changes. And that comment alone would be extremely helpful.
Yes. Reem?
Um, I want to say that, first of all, the work that the caucus is doing is amazing work. And they did that before when the ethics was going to be changing their language, and it did have an impact. So we need to believe in ourselves and our collective work. And we need to believe that ASHA does listen to us. And we are ASHA. As much as ASHA leadership is ASHA leadership, we are ASHA and we make ASHA. So we need to remember that. I think 2 points that I want to add is that we have a lot of stories to tell that can show the impact of this work. I can talk about, the example where we had this amazing clinician, Julia Roberts, not the one that, was in Pretty Woman, but she's amazing clinician that, talks about equity in serving autistic population. And she talks about, and it would be great to listen to her. She has an amazing work that you can check her email, her website. But she came and she presented to our students about the ABA design, the work that has been very much common to do with autistic population from her perspective, and she's autistic herself. And at the end, I did meet with the students to reflect, and many of them were working. They're still working as assistants. And they said, just listening to this, listening about the ableist ideas and what does it mean when we hold somebody and in a way thinking we're helping them, but we're forcing them to point on something, or we're forcing them that, if they ask to go outside, that they have to wait 5 minutes because this is what the rules are for that type of treatment. And how they took that knowledge and they shared, a lot of them shared information about how this one meeting impacted them. So one of them said, I started just like, not following the rules 100%, and the child started calling my name. Another person said that I started the meeting with the parents by asking the parents to start talking, not me start talking, parents of color. And it changed everything. All of a sudden, we got more information about the child that we had never gotten. And I had another student that said another thing that was so influential. I'm now blanking out, but the kid used to always be unrestful, and then she basically started just saying, I understand it's hard and I'm not going to push you to do things. That's all that she said. She gave the dignity to the person. And I think we have a lot of stories, each one of us, to show that this is the right thing to do for what we have been meant to be doing. What is the mission of being a speech therapist? And I think we have a lot of education to do by sharing these stories. And I would like to ask everybody to even share these stories when they write to ASHA about the impact of having these moments when they studied with Amy, when they studied in the program where I teach, and other programs, and the speech therapists that took CEUs, and they started thinking about it and how it impacted them. Because I think the the community and the society, including the political leadership, when they listen to these stories, I think it will make a difference. I do believe in dialogue. I am a person that everything in me is I'm the minority and the minority and the minority, everything that I am in. And I do believe in dialogue. I do believe if you bring the stories of the lived experiences of people, people will listen.
Yes.
And and ASHA, I really encourage them to get this from the experts that are doing this work. Consult with them instead of just doing this work without consulting with the experts who might provide them with a lot of information that might make a difference, and maybe we might make a difference for the society, not only for our profession, because our stories are real and the effect is real.
I I have to wonder if, as a profession, this is pursued, if this change goes through. Um, my my concern is long-term ramifications, not just here in the States but globally. So Betty and Vishnu, y'all are literally outside of the continental United States right now, and Vishnu, I know that you mentioned that you studied the decolonization and impact, but how will this impact the greater world of speech pathology globally?
Um, I think one thing we also haven't talked about, or one, I would just want to say, kind of population in some sense, or people, individuals. The impact of this is what this will have on indigenous side that we serve, the indigenous population, because that's something that we don't really enough talk about. Because oftentimes when we talk about diversity, we think about racially or multilingual, so the indigenous people are always left out. And being in Australia, the indigenous context is very important, because there is in New Zealand, there is a treaty that respect and honors indigenous people here. In Australia, they don't have a treaty, but there was a referendum that was recently failed. People can look it up. I won't explain this podcast, but people can look it up. What was the referendum that happened in Australia recently? And I think this is going to impact and discourage other organizations similar way, advancing diversity, and that is going to disproportionately impact the most vulnerable, particularly the indigenous, or even refugees, for example. All of those marginalized groups are going to be really impacted. But globally, I also think a lot of organizations do look up to ASHA,
Mm-hmm.
and they emulate ASHA in so many ways. Now, if DEI, I'm not a really big fan of that word. I think we should move more towards criticality and decolonization. But that's too radical for this podcast, right? But even if we have to do bare minimum for the bare minimum, which is as Betty mentioned, the lowest common denominator. If ASHA is truly a leader of an organization, they should be rising above and showing that collective leadership, saying, listen, we are doubling down on this. We are doubling down and
Yes.
resisting on this, right? But that is not what is happening. So that compliance again makes me really concerned, not just in terms of the value, but in terms of the future of the profession. We are going to lose not just the client groups, but we are going to lose a lot of justice minded clinicians coming into the field. If this is not integrated into our values and standards, who is going to come? I mean, we are going to much more, the profession is going to be homogeneous. And I think that is going to really create an impact on the quality of care that we give, really. So I think this is going to pose an existential threat, yeah, to the profession in the way, as we see the profession, because we are talking about innovating the profession, bringing transformation. Now innovation and transformation cannot happen without imagining justice. This is the reality, right? Innovation and just we can't go back to 1960s or 1800 and pretend that that is innovation or that is justice, right? But currently Asha's action is taking us back there.
There's a really wonderful book called The Politics of Language, and it talks about the manipulation of language in controlling the populace. We're in that moment right now, and it's really clarifying to read it. And what a statement it would be for a association about language to remove itself as a domino in that chain, right? And as Vishnu was saying, we do have a lot of influence. We may think of ourselves as a small, fish in the pond, but we're not. We actually have quite a lot of influence. To not buy in to this double speak that we're, in this moment where anti-discriminatory efforts are being called discriminatory. I mean, it really is mind bending. And, we can acquiesce for our temporary safety, which I would argue is not actually a safe position anyhow. Or we can look in we can have a longer view of what our place is in history. And I think the other dog whistle that happens with this kind of work is that it is cast as a radical left leaning. No, if you respect freedom of thought and speech, which is a core American value, we should all be supremely offended that this is happening. So, yeah, I would really like to urge for all of us to take a bigger view of our place in history, what's happening here.
I minored in history a lifetime ago. And my favorite, amongst other things, because I'm super nerdy, but my history professor always, the one quote that stuck out was she said, history is told from the perspective of the victor. And that's why when you hear a voice that was escaped, that was free, like Anne Frank's, it's so powerful. I I agree absolutely with everything you just said, Betty. And we do need to be bold in the face of adversity. And ASHA, we are ASHA, but we implore you, stand firm. Okay. I have to be respectful of everybody's time. Um, because I knew we would go over, but we've joyfully gone over. um, and folks, just so you know, gentle reminder, we are recording literally on June 16th with this to roll out on June 17th. But this episode, because of the timeliness of it, will not count for an ASHA CEU for 16 days from tomorrow. So I don't think it'll count
July
as
2nd.
July
Let's say
2nd.
July.
Yeah,
Come
July.
back July 2nd if you're listening to this for CEU. Fill out the survey and you will get credit.
Yes, but we didn't want to sit on this. We want this to go out to get everybody to engage in maximum time. But to give the moment, if we could, everybody could go through and give their final thoughts and then maybe share if you have if somebody listening is so inspired, if there's a place that they could donate to or support, if you don't mind adding that one to it. Reem, you want to kick us off? Okay. Faye, you pulled us together, my love. And for this, I don't have enough of a thank you, but give us your thoughts, ma'am.
Sure. Cultural responsiveness, cultural humility isn't optional. It's clinical competence.
Yes. Yes. To the point. Now, who can we donate to?
I didn't come prepared for that. I have no idea. I mean, I think, this is something doesn't require money. This requires action. This requires us just, going to ASHA and say, hey, let's stop this right now. And,
Yeah.
and let's, this is what it requires. I really don't, I mean, if you want to give to somebody, the ASHA Foundation, I don't know,
Yeah. No.
but, yeah.
Well, also, guys, Ash Foundation actually funds clinical research. And when research is getting cut left and right, we need our dollars to go there more and more. So, yep.
Or the
Okay.
PAC.
Yes, ASHA PAC. Oh, hell yes. I'm sending my money to the ASHA PAC. Okay. Amy, final thoughts and where can we donate?
Well, one of the best quotes that I've heard recently on this, I just heard today. So I'm going to try to quote Vishnu on what he said as my final thought, because it's really powerful. And I know I'm not going to quote it as well as he said it, but I'm going to try. But essentially, the statement that was so powerful to me is innovation and imagination cannot happen without justice. And I think that that's
Yes.
so needed in this conversation for reflection.
Yes.
As far as organizations, I mean, I was going to say, so we have a student organization at the University of Cincinnati, Multicultural Concerns in CSD, and it is an undergraduate student-led group who is doing amazing things and just bringing things like this to the conversation all the time. And they are going to not be able to accept any university or faculty funding anymore because of our state bill. So I would love for anything to be able to go to them. I'm not exactly sure how to do this right now, but I could get that information for sure.
Yes. Send me an email with
I will.
contact information and I can add it to the show notes. I know Archie, who is also balancing mom life of tinier humans, had to step away. So I'm going to go out on a limb and request y'all become a member and join the Asian American Pacific Islander Caucus. Did I do that? AAPI, correct acronym? Yes. Uh, they just had a absolutely amazing research symposium that was hosted to highlight research that's done by members from within. I remember clinically, they have over 40 different languages represented by their membership. And so if you need help understanding or working with a family that does not speak your language, I remember when we interviewed years ago, she was explaining that there's resources there to support a therapist to gain cultural humility and to grow their skill set to serve those families. And I think that is an amazing initiative. Betty, Vishnu, thoughts and donation requests, please.
Do you want to go first, Vishnu?
Yeah, I think I'll start with donation. Like everybody, I haven't thought about donation,
Mm.
but this conversation is making me feel that API Caucus is that one organization that I would like to donate because they pulled us together and they've been doing a lot of important work. So this is a very important organization. So therefore, we should be donating to that organization. In terms of my final comment, I just go back to once, I was just speaking to Eva Hyder, who I always respect and admire, and I was in a crisis mode, and then I think we were all in a collective meeting, and I said, well, what to do? There was a crisis moment, and then she just said something very simple. We just need to do what we need to do. We just need to do it. This moment is called for,
Mm-hmm.
this is, we need to work in collective and be the enlargement of our own possibilities. That's what we need to do.
Yeah, I don't know about the monetary donations, but right, there are a lot of things we can donate. I think, in our environment, we can look around. There are a lot of individuals, organizations being persecuted for doing lawful, work to advance equal opportunity. And, there are people losing their jobs, their funding being cut. There are a lot of entities and persons under threat. So, to whatever degree you can have influence to help, just look around. It's just little fires little and big fires everywhere. Um, yeah, and to do our part and not look away.
I thought I will get more ideas of what I'm going to say by the end. One, I know speech therapists are not, paid as much as they should be paid. So the idea of asking them to pay something, I'm just like a little bit hesitant about. But if there's anything, I think, and if you can, definitely the API. I think the API has been. Um, has been doing leadership work and bringing us as a community in a way that makes a difference and makes an impact. And I'm very proud to be a member of the API. And when I look back at what they have done specifically with the ethics revisions that were going to go, to be changed, I think of them and there's like a good feeling in my heart that I know we are together in this and that we have a group of young people that are doing amazing work. I'm elderly, like at this point, I feel like, I've been in this for so long, but API brings this fresh feeling for me. The other thing that I just want to say, because me and two friends from here, we were like texting about comments that has been about in like a Facebook group about this change, and one of my colleagues, I'm not going to mention the name, she was like, it's so hard to read the comments, like people are not getting it, they're saying, oh, I can't wait to be done from being asked to do DEI, and I this is blah blah blah, very negative things. So I want to tell those people that DEI is about love. It's about really
Yes.
and love in the terms of James Baldwin. I love reading James Baldwin in these moments more and more. And I was raised Christian, Catholic Christian, um, and love is about sacrificing sometimes. Love is also about taking care of, the people who are in need. Love is about standing up for each other as a community. And love is about doing this work out of love. So for me, DEI is about these moments where you realize that I can do it better for those that I to take care for. And I want to give you just one story. Um, I am a storyteller. When I was in Nazareth and I was working with a child who got the cochlear implant, um, I offered to give that child extra time because I was so, so, so wanting her to be able to use oral language. And the child uses sign language. And I was young. I was, trained in medical, oriented programs. And I was thinking I'm doing something out of love. I was thinking I'm giving this girl an opportunity. I was the only Arab speech therapist in the area. People were calling me for private, for anything that they were willing to pay, just, come and work with our kids. And I was thinking I'm doing something really amazing. I'm volunteering my time to make sure this kid benefits from the cochlear implant. All my students know this story, by the way. Then the mother went and complained because the girl didn't want to work 5 days a week at the end of school day to just, practice oral, language production, and, to distinguish between and oo and ba and be and all of this. And it didn't hit me until I started reading about ableism. And it hit me that, I was doing something out of love, but that wasn't the love that I was meant to give. And for those that think that DEI is something that is bad, think that DEI is something that is excluding, think again. Because I can tell you, there are times that I wake up in the middle of the night and I keep thinking, this girl I have done differently. And I think we all should have these moments of reflection and openness and think about it from a place of love, not from a place of I'm with this side or that side, because at the end, being a speech therapist is one side. It doesn't matter what's your political association. I don't care. I can talk to anybody, and I am convinced that if you look at the person out of love, you'll understand that our morality necessitates that we have to maintain the DEI in our education and in our understanding of our roles. So, yeah, that's what I want to say.
This is the Jesus I know. Yeah. I'm gonna cry. Erin?
I think my biggest thing, and I've said this in conversations with people, is like now, like we've been talking about, now is the time where we have to be louder. There's no assumption, and the people that we serve and the students that we work with, there's now no assumption that they're safe with us. We have to be loud about our support and our love, and that's how someone can feel safe. And I think that's so important, because I hear from a lot of people that it's like, well, why do I have to be the one to say something? Or why do I have to put it out there specifically? Or why do I have to do that? Because you have to. And if you're in the position to be able to be the one that's questioning whether I have to say it or not, then you should. Because it's not it's our job. I mean, Michelle, saying, we, as a white woman, like I have privilege, that I have to understand that, and I have to sit in that, and I have to be willing to sit in the discomfort, because for somebody else, the discomfort doesn't just, they don't just get to move away from the discomfort. They don't just get to say, well, I'm not going to deal with that discomfort today. You take more time to sit in it and feel it and be loud about it, because that will build safety, that will build community. You will find your people, you will find the person next to you that you can have the conversation with. And Jackie Rodriguez, who is on Learn With Me on Instagram, is phenomenal. And she said the other day too, she's like, we are ASHA. And so asking these questions, we maybe have the conversation with a colleague. Don't assume what their thoughts are. Like, we have to be willing to get uncomfortable and know that we might have to work to help them better understand. And that is a part of our job. So I think that's something I've really been trying to think about, is like, what should I be doing? Why am I putting it on somebody else to be doing it? Like, that's part of my job and my role. As someone that has some of that privilege as well too, and thinking about that and getting comfortable with getting uncomfortable, because that's what we should be doing.
Yeah. Folks, you have been with Erin and I for over 300 episodes. I think after that many hours of time together, you know where our hearts lay. And we implore you to take a stand with us. Please go to the proposed changes. Again, they'll be in the show notes, and voice your concern. Also, I want to thank you all for joining us all this time, because we've created this community where we can have a shared safe space to hold these conversations in a crunch when things matter. And for this, I am very grateful. and Faye. Dear friend, thank you so much for pulling all of this together. Y'all, all I did was call her at Petco. She didn't know I was on the verge of a panic attack because I was like, we have to do something. What am I supposed to do? And I was spiraling because I had written 40 discharge notes. The HVAC system was shot. And then we got a new puppy who's just pooping everywhere. And so, like, I was like, I need to do good things, but I'm holding on by a thread. And Faye was like, I've got you, with like this ethereal calmness about her. And here we are. So, I mean, we didn't fix the poo situation.
Thank you so much for the forum. And I hope there will be others that will join you, other podcasts, other people that are going to be talking, because as you can see, there are people out there who are willing to explain and
Yeah.
with a lot of passion and a lot of knowledge.
Yes.
And so let's get the word out and let's act. Thank
Yes.
you.
Yes. And also our sweet friend Gerald Jackson. He couldn't make it. He was trying to move heaven and earth to get here, but you know, he owns like a major company. So like shout out to Gerald. We feel you in spirit. But Faye, Amy, Archie, Betty, Vishnu, Reem, Erin, thank y'all for coming on. Hold on one second, guys.